Good morning and welcome to Big Day of Training here at Compression Care. In this session, we're going to be talking about how to get the most out of working with compressionguru.com. I'm Steve Lewig. I'm one of the co-founders of Compression Care, and I work very closely with our Guru team. So we're going to be talking a lot about some fun stuff with Guru today. If questions come up along the way, please add them into the chat, and I'll make sure we address those all before we're done. And it's exciting to be sharing with you today because it's an official unveiling of some things that we've been working on for the last 6 months since we acquired compressionguru.com. And the Guru team has really been hard at work, and we've been testing these new features over the past few weeks. We've gotten some really strong positive feedback. So I hope you'll find these to be great tools, help patients, and save you a lot of time and effort in the process. We're going to jump right into it. I'm going to be sharing 3 ways you can incorporate Guru into your workflow. But first, I'd like to explain how compressionguru.com fits into our ecosystem here at Compression Care. The primary thing you need to know about Guru, because it factors into everything else we're going to talk about, is that we sell just about everything at what's called MAP, or minimum advertised price. And it's the lowest retail price allowed by the manufacturer. Not everything has a MAP, but in those cases, we have a pretty straightforward pricing strategy, and we view self-pay as the safety net for patients who don't have adequate insurance coverage for any one reason or another. So we don't want to lose money selling at Guru, but our focus here is on this being our affordability safety net. And that's part of our mission here at Compression Care, is to make high quality compression care more accessible, affordable, and convenient, no matter where you live. And so Guru plays a really important part in how we really plan on delivering on that over the longer haul. The first new feature we're going to talk about today, some of you may have already been using. It's inside our Peace of Mind portal at Compression Care. We've now created a connection with Guru with the site, so you can make a self-pay patient referral right inside the Compression Care portal. When you're in the dashboard, in the upper left, you can actually refer a patient for insurance. Right below that, it says self-pay patient referral. You just click on that, and this is now where you can, if you're already in the portal and you don't want to have to switch over to Guru, you can just right then and there select add a patient, or select one from the list, and then choose the items that you want the patient to purchase. The entire product catalog from Compression Guru is available right there in the portal. When you hit submit, that order goes straight to the lovely Judy Nelson on our Guru team, and Judy follows up with the patient for you. She helps the patient buy what's in that cart, either on the Guru site or over the phone. Patients absolutely love Judy. She's so patient, and she really makes it easy for them. So when you submit through the portal there, everything will just go straight to Judy, and then she will follow it up and give you feedback so that you know when the patient has made that purchase, if there's a problem, and things like that. So there are 2 options now directly from the Guru site itself. This first one is brand new, and we've had a few people testing it where they're telling me that they're going to be using this all the time. So you may be among those who will be really excited. We call this our cart to quote feature, and here's how it works. You shop the site and select items for the patient, but instead of using the traditional shopping cart, you select add to quote instead of add to cart. And then these show up in a little dolly. You'll see a shopping cart, and next to it is this dolly. And the dolly is where you're building your quote. Once you've got all the items you want selected, you submit the quote to the patient, and then it'll allow you to provide the patient's contact information And you can do a couple other things at that point. You can check a box if you want us to also check their insurance and see if their insurance would cover any of these items. And the second thing you can do is provide a note. And when you provide that note, that note will become part of the quote, and it allows you to advise the patient. And if there's anything you want the Guru team to know, that's the place to put it too, because when you submit your quote to the patient, first you'll get a confirmation that the quote's been sent. And from then on, when you're logged into the site, you'll see up here quotes, and you can see any quote you've sent a patient previously. And here's where you'll also know what the status is of those, whether it's in process, we're waiting on the patient has purchased it, or if the patient abandons that quote, you'll know that they've abandoned it, and you'll be given the reason they abandoned it. Whether there's typically 3 reasons a patient would abandon a quote. One is they just don't want to do it. They refuse. They abandon for affordability reasons, or they abandon because they have other concerns. So typically, you'll know it will be Judy will communicate to you, hey, they've purchased the cart, or hey, they are refusing to purchase the cart, and here's why. And so you'll get a confirmation. The patient will get a thing, and that quote is tied back right in the subject line in the email. It's tied back to your name has recommended these products, so that we're trying to create this connection back so that they realize, oh, this is real. It's not a scam. It's something that was initiated by you. And then your note to them will also be included in that quote. They'll see the items you've selected, and they will see your note. Then Judy will do follow-ups, and when the patient buys, you'll get another update. When the patient says no, you'll get another update. And if the patient ghosts out for 2 weeks, you'll get another update saying patient's been totally non-responsive. And again, the link to get this set up, I've put it in the chat, and we'll certainly answer any questions that anybody has about this before we're done today. The other cool feature that we've added to Guru for medical professionals like you is what we're calling custom shops. These are basically your very own shop within the entire Guru site that only shows the products you commonly recommend, and it also lets you create custom combinations of products. The best example is like a bandaging kit. Maybe you have a standard arm kit that you like patients to use, or a standard leg kit, and you give them a list of bandaging items that you want them to say, bring next time when they come. Well, with this feature, you can create a product bundle, and you can give it its own name. So it could be, Steve's arm kit, or it could be the name of your clinic's arm kit, your leg kit, your full leg kit. You can make as many product bundles as you want. And other examples of bundles might be, maybe you commonly have people with an arm sleeve and a gauntlet, or an arm sleeve and a glove, or you maybe have a combination of garments that you use when you have a full leg situation. You might want them to have a foot piece and a leg garment, and maybe you want them to have a wrap also to go with that. There's all kinds of different scenarios that are common, and so you can bundle those products together, and then it's much easier for the patient because they just select that one thing that you pointed them to, and it gives them, it's gonna sell them all the components of that product bundle, and it's all at one price. So that's one of the really cool features of having the custom shop. The custom shop means that you'll also have and I'm going to show you an example here real quick. This can either be just for you personally as a therapist for your patients, or it can be for your entire clinic to use the same shop. We have customers that individually have their own preferences. We also have clinics that try to standardize so everybody's doing the same thing. And this accommodates either scenario. The custom shop has its own URL. So like compressionguru.com/ the name of your clinic or your name. And we generate a laminated one-page marketing piece that has a QR code on it. We'll send you as many as you need, so you have one in every treatment room, and you can just have that handy to have customers, point their phone at the QR code. It takes them straight to the shop, and you can say, "Hey, buy 2 arm kits and bring them with you next time you come." Or you can say, "I want you to order this or this or this." This is designed to help shortcut them so they're not distracted by, there's literally thousands of items on the Guru website. And so this allows them to navigate much more quickly, specifically to only the things you want them to see. And the custom shop it's really easy to set up. You just come through this resources demo page, and it will allow you to request a shop. Tell us what you want that shop to be. Is it for your entire clinic? Is it for you? What kinds of products do you want in there? And then we build the shop, send it to you for approval. And once you sign off on it, then it's live and available. And then we build the marketing materials and send them directly to you, so you have that ready. And I think this way, referring the patient becomes much faster. When you combine custom shop and cart to quote, it allows you to come to your custom shop. It takes you straight to things you're going to need. You don't have to narrow the website down. And then you can put those items in a quote instead of having the customer go there. And you can send the quote so they got offered exactly what you want them to have, nothing more, nothing less. And so I think that these are 2 features that you can use one or the other, or they combine really, really well. We're really focusing this year a lot on affordability for patients. Costs skyrocketing. Premiums have gone way up. Deductibles are getting higher. It's important that we're all looking for solutions to that. And Guru fits into our whole offering because it's the affordability safety net. And this is for the patients who either don't have insurance coverage, they lack adequate coverage, or need items that aren't covered by insurance. So selling at the lowest prices allowed by the manufacturers, we're doing that. Plus, we're doing 2 more things that I think are worth noting. We've added through 2 partners in particular, Klarna and Affirm, we've added 2 ways that patients can break down purchases on Compression Guru into 4 different payments. So when affordability becomes a challenge, they can break down the cost into smaller payments that they make over time. And these partners, Klarna and Affirm, give the patient some options in terms of how many payments they want to break it up into, over what period of time they want to make those payments. And it really just allows them to have some more options to make sure that they can get access to the care that they need. We've also given patients the opportunity to initiate insurance benefits checks on their own at any time. So if they're ever wondering if insurance might cover some or all of the costs, they can easily find that out. There's a feature now live in the Guru site that allows the patient to submit all of their insurance information right through the website. And then we have a person on our benefits verification team who is really assigned to interacting with patients through the Guru site to help them understand what's covered and what kind of what access they have to coverage along the way. This is obviously, when you have their demographic sheet and you submit it as a full-on referral, that's ideal because it gives us kind of all that extra information we need. But this way, if it's a burden that you want to place on the patient rather than yourself, you can send them over to the site and request a benefits check that way. We've expanded the customer service team at Guru as well. So you can always talk to humans whenever you need help. They're standing by. They will get you access to this new cart to quote feature. They can help you request and set up a custom shop. They can answer any questions you may have about how to make sure that you have access to all these features in the site. The way that you access the cart to quote feature, it is you establish an account on the Guru site. Then if you follow this link in the chat, you can click a button and request access to cart to quote. What they will do is upgrade your account so that you have access to all the medical provider specific features, and that will include cart to quote. And it also will provide you with a little bit of training on how cart to quote works. Obviously, if you have any questions, Felipe is our kind of spearheaded this project inside the Guru team. And anyone, Jose, James, Judy, Alyssa, anybody on the customer service team can connect you with him or answer your questions and make sure that you get set up and that you understand how to use this feature. I think it's going to be really popular, particularly for those of you who are sending people on a regular basis to purchase, sending patients to purchase bandaging and things like that. These are typically non-covered items, and so they're most obviously cash self-pay. And so when you know that it's something that is self-pay, this is a huge time saver because you can just put it all in a cart and you can or put it all in a quote and you can send that quote directly to the customer. And then we're here to help them make sure that they navigate the website and or just help them purchase it over the phone. Your elderly patients in particular, Judy has just the patience for that kind of scenario. And she's really wonderful with people over the phone, and she helps them to be able to literally make the purchase even when they're, how should we say, untech savvy. And she's just really good at working with low tech patients. So I just wanted to run you through these features and explain how these are designed to help you and help you help patients. If there's any questions, I'm very happy to make sure that we address those straight up. There's as we kind of move forward, this is where kind of showing you an overview of our process at Compression Care. When you submit a full patient referral, it's going straight into benefits verification. And we've added an industry first care coordination network so that when we are not in network with that patient's insurance, we now have the ability to find a billing partner who is in network and then make that connection. So that work doesn't have to happen on your end. You're not entirely responsible for having to figure out who takes what insurance. And our director of patient intake and care coordination, Ross Gardner, he's been working very hard last several months to build up a database and build up a network of care partners who, when we're not in network, we can absolutely make sure that we get that patient connected with someone who is. And that's going to make sure that they pay the least out of pocket. We also offer our lowest out-of-pocket cost guarantee. When you submit a patient through Compression Care, we're automatically comparing what the patient's out-of-pocket costs are for deductible, for coinsurance, et cetera, against what it would cost to purchase the same thing direct at the lowest retail price allowed by manufacturers at Guru. And whenever the cost is lower, we give the patient that option automatically so that they understand you have, I'm just making this up, but you have a $5,000 deductible that hasn't been met. These garments are going to cost $400. If you buy them directly from Guru, they're going to cost you $325. And so in that scenario, the patient is being offered basically two options. You can pay the $400, it'll go against your deductible, or you can purchase direct for $325 and save some money. Those numbers are all made up, but that's typically how the scenario plays out. And patients will almost always choose the lower, but maybe they're really close to meeting their deductible. It still gives them the option to do what they feel is the best financial decision for them. We're also allowing patients, when they're in compression care and they're paying their out-of-pocket costs and using their insurance benefits, we let them break those costs into up to 3 equal monthly payments. So we're doing a lot to help patients really manage the upfront cost of setting themselves up for really successful at-home maintenance phase. Here is a link. The QR code will take you to a resources page that has copy of these slides, has the link to the resources for medical professionals page on Compression Guru. We're giving out 4 really cool cheat sheets today in various sessions. One is optimizing garment selection against the new Medicare standards. The second one is how you can factor Velcro wraps into your garment plan, particularly as it relates to Medicare and how Medicare treats all that. The third one is how to create a modern plan of care. And it's really just advice on how you can make sure that your plan of care is documented properly up front so that we don't have to circle back to you and ask for other documentation, and it speeds up often the process. What we're finding from a series of Medicare audits that have been conducted during the second half of last year is that Medicare is paying really special attention to the justification that you make for custom garments and the justifications you make for accessories. And that could range anywhere from adding a silicone band, a zipper, a dart, any of those kind of accessories where you're adding features to the garments, but also things like donning aids, care kits, and skin care. So when you are incorporating additional features or you're doing custom garments, it provides a lot of guidance in terms of how to word that in your plan of care and how to make sure that it's all properly documented up front. The fourth one is how to manage your professional risk. One of the things that we're learning is that now that there's a written standard, here in this industry, it's been kind of old westish for a while. We were all doing separate things, kind of everybody doing what they felt was right. It's now becoming really clear what the basics, what the minimum standards are, and how we all have to react. And so it talks a little bit about how to make sure that what you're doing in your communication to the patient and in the plans you're building for the patient in their at-home maintenance phase, that it really meets and exceeds the standard that has now been established by Medicare. So all of this is going to be readily available. We're also doing all day long today, we're doing a Microsoft Teams virtual lounge. And we have staff members over there who are available to answer questions, to give you an opportunity to meet some other people from our team. And you can also request any follow-ups. You can make sure that anything that you've learned about today in any of the sessions, that you have the ability to to follow that up and take action. So I've just put the link to the Teams lounge here in the chat. And if there's any other questions, I'll be happy to address those. Otherwise, I'm going to let you take a coffee break and a bathroom break and whatever else you may need this morning. I really appreciate you being up and around this early. Some of you earlier than others, but we have over 400 therapists participating in Big Day of Training. It's our first effort for this. We're really excited to be sharing with you on all these different topics. I hope you found this to be useful. I hope that you're excited about how you can incorporate Guru into your work with patients, and particularly this card to quote feature and custom shop. I think ideally everybody should have a custom shop so that it helps you kind of cut to the chase when you're trying to connect patients into products. It also, we're building one right now. Somebody needed one for their purchasing department so that their purchasing department always got the right things. So we're finding all kinds of unexpected uses for it. And I really appreciate you joining us. I look forward to seeing you throughout the day elsewhere in other topics. And if there's anything more that we can share with you on how to build a relationship with Compression Guru, there's some people from the Guru team that'll be over in the Microsoft Teams Lounge, and there are in this resources, you'll be emailed this tomorrow as a follow-up. But if you want to head there today, that QR code will get you there. Thank you for all you're doing for patients. Thank you for working with us. We hope that we continue to show you ways that we can enhance the relationship and help you help patients. We really appreciate the opportunity to spend time with you and share all this today, and we look forward to seeing you in another session soon. Thanks.